Meet Dr. Aaron Olson. Early in his engineering career, he realized he wanted to do something more with his life, something that would involve helping people and building relationships. He found his calling as a family practitioner.
I was working as an electrical engineer just out of college down at Motorola around Chicago. Enjoyed what I did. Motorola was a great company to work for. But just thinking about the future, when I had a family and all those sort of things, I didn't envision myself being, totally fulfilled. And I also I wasn't crazy about living in such an urban environment. And so I sort of started to do some soul searching, thought about medicine, but thought it was sort of crazy to go from electrical engineering to medicine because it's a fairly big leap there, at least I thought so at the time. Thought about things like teaching. I sort of come from a family of teachers. My mom's a teacher, my brother's a teacher. I sort of had a little bit of a passion for that. Thought about politics a little bit because I thought that, well, that's a good place to make a difference, but that was a little bit of a intimidating something to consider. So sort of weighing all those options, I thought medicine made the most sense. It was a way, it was a great way to help the community. It was something I would enjoy. It would involve, having relationships with people, particularly in an area like family medicine, where you're getting to know people and sticking with them, for long periods of time.
Describe yourself. What kind of doctor are you?
Sometimes doctors have a tendency to speak in a language I think that's not easily understandable to the everyday person. And when I was in my training, I always told myself I never want to be that kind of doctor. That being said, I've now been doing it for 10 years and I catch myself doing that sometimes. And so whenever I do, I say, listen, if I ever do that, I just tell the people to stop me and say, hey doc, speak English. It just doesn't make sense otherwise. I also encourage people to keep their own little lists of medical problems and like the medications they're on, so if they ever end up in the hospital or that sort of thing, they have that. That can be really invaluable to their care in the future. So.
Do your patients benefit from having a hospital right in their community?
Well, I'm an employee of the hospital, and so because of that, we're very well connected with the hospital. We share the same electronic medical records, so our data flows back and forth, which is sort of a huge problem in medicine in general across the country, is that lack of information that flows across. I, of course, know all the sort of specialist providers that work inside the hospital here, so if I ever want to talk to them, if there's a questions, I run into them in the hallway, they're a phone call away, a page away. Having those sorts of close working relationships with the other physicians and with the facility, the hospital itself, is a huge advantage. When my patients end up in the hospital, I try to come up and see them every day they're here. We do work in a hospitalist environment now, which has its advantages and disadvantages, but I still try to be involved in the patient's care, sort of look over what the hospitalists are doing and make sure that I agree with it. And that way I also know what's going on, so when the patient leaves the hospital, comes back to see me, I'm very familiar with what happened there. I don't have to call up, Marshfield or Wausau and say, hey, can we get the discharge summary on this patient? And if I have a question about what happened there, I'll often know the answer because I was there seeing the patient every day.
What do you like most about being a family practitioner?
Well, anytime when you're in with a patient and, they're struggling with something and you're able to really figure out what they're struggling with and able to identify a solution that either solves the problem completely, which is ideal, but not all that common, and at least in my type of medicine. It's not like surgery. It's like you got an appendix, you take it out, you're done, you've cured the patient. Most of the problems that we deal with, there's not great cures like that. But really helping people help themselves make their lives better. I mean, that's the sort of thing that really comes to mind when I think about what's so fulfilling about medicine.
Dr. Aaron Olson.